Well, we know the nation is reeling after the deadly mass shooting in Uvalde, and the overwhelming stress of tragic events can really lead to mental health concerns for many. This morning, we are talking to Dr. Anne Marie Warren, a psychologist and trauma researcher at Baylor Scott & White, about coping with trauma. First of all, thank you so much for joining us, even during a time when we wish this had never happened. But I know your insight will help a lot of people. So can you explain to people, when you're dealing with traumatic events like this, unexpected events, what challenges do you feel that the families facing this are going to have for the next coming days and weeks?
Yes, and Sharon, thank you so much for having me on today, and agree, we hate that we're having to have these conversations again, but it is critical to understand that emotional responses to traumatic events really vary. Some people may become very numb or detached. Some people may become very sad, very angry. So there's a wide range of emotions as well as behavioral reactions. Some people may withdraw. They may have trouble sleeping. They may have nightmares. So really we see a broad spectrum of mental health consequences after something like this.
And I'm glad you brought that up, because you mentioned, of course, responses that are normal and natural in a situation like this, but there are often responses or common reactions to an event that are not normal. So what should we be watching out for if we ever experience this, or family or loved one experience a traumatic event that are cause for concern?
Yeah, it's so important that we understand that there is an almost normal reaction to trauma. And again, it can vary, but if it would almost be strange if someone didn't have some of the things I described earlier, the emotional responses, the behavioral changes. Where we really get concerned, though, is that if those responses are long-lasting or chronic. So if we look at the normal trajectory of what happens emotionally, psychologically after a traumatic event, most people in their lifetime will experience a serious traumatic event. However, most people have a natural recovery to that event. Some people, however, have more difficulty processing that. And so for those people, especially if it lasts 30 days or longer, and these emotional and psychological and behavioral effects are affecting their relationships, their work, their occupation, their social engagement, then we really might want to say this is time to seek a professional who can assess to determine if these natural responses have now become something similar to post-traumatic stress.
Dr. Anne Marie Warren, I want to thank you so much for talking to us. I know our time is short here, but we're going to have contact information for you, so people, if they want to reach out and have any further questions, we can find it on our website, CW39.com. Thank you for your time, and I know it's going to be a busy time for you, just talking to a number of people, but your expertise is so really appreciated at this time. So thank you again. We appreciate your time.